Good afternoon. Thank you so much for taking the time to join us at Global Genes Live, a rare patient advocacy unsummit. We are excited for our upcoming session, Mitigating Familial Financial Toxicity Through Planning. My name is Alan Richardson. I am the Executive Vice President of Strategic Patient Solutions at the Patient Advocate Foundation, and I will be your moderator for today's session. Before we get everything kicked off, I want to review a few brief housekeeping notes. First, all attendees are currently muted by the moderator to reduce any interruptions. We encourage you to use the chat function in the ON24 window for any questions you may have throughout the session, and the moderator team will present them to the speakers. To open the chat, please click on the blue chat button located on the meeting controls at the bottom of your screen. If there are questions that are not able to be addressed by the speakers or we run short on time, we'll do our best to follow up after the program. Also, make sure to post your top takeaways and fun moments during Global Genes Live on social media and tag #GlobalGenes for a chance to be featured on our social media channels. The official event hashtag is #2020GG Finally, we encourage you to participate as active listeners and take advantage of an opportunity to hear from leaders and experts here and ask questions of them. This program is your time to learn and find answers on critical challenges in rare disease research. I am also pleased to introduce our discussion leaders, Barby Ingle, President of the International Pain Foundation, and Christina Hartman, Senior Director of the Assistance Fund, who will each share more about their backgrounds later in the session. Before I turn things over to Christina, though, I'd like to kick things off by telling you a bit more about Patient Advocate Foundation and our resources for patients and families. Since our founding in 1996, our mission has not changed, and it's basically to provide case management services and financial aid to Americans with chronic, life-threatening, and debilitating diseases. Of course, rare diseases fall into that. This slide kind of shows the roadblocks to access and affordability, the medical and ability to pay, medical debt and ability to pay, followed by insurance access, emotional distress, employment protections and workplace entitlements, and cost of living impacts. In 2019, Patient Advocate Foundation served 145,815 patients through all of our programs, 23,702 in case management, over 73,000 in our copay relief program, and over 42,000 through financial aid programs, and 6,900 through our email helpline. We have served 1.3 million patients since our inception in 1996. Specific issues that we help with include ability to afford hospital and facility cost share, inability to afford medications, inability to afford transportation expenses, rent, mortgage, and/or utilities. And this is true for pretty much any disease state that we've seen here at PAF. In 2019, we helped 619 distinct patient diagnoses, Of those, 238 were rare diseases, which was a 7% increase over 2018. Since we're talking about the financial toxicity and cost of care, we did a survey of our patients from May 2nd to May 25th in 2018 regarding that exact subject. And you can see here that we found that Americans are incurring increasing out-of-pocket healthcare costs and how that has increased from 2005 to 2015. A lot of the unexpected healthcare costs were also placing a significant burden on the patients. 37% had unpaid debt associated with their medical expenses, and 27% have skipped needed medical treatment because of the cost of those treatment protocols. When discussing barriers, most of our focus group attendees focused on the social cultural considerations and provides level factors. So those social cultural barriers included trust and shame issues related to talking about money, particularly with their provider, the regional and cultural norms around work disruption, racial and class bias, and the differences between health systems, because you may be in one state and be on a Blue Cross insurance program, and it's different in another state. So having to have those differences between those. The provider barriers include, not surprisingly, time, lack of resources to help, and the trust and relationship challenges. So the cost impacting treatment decisions, we asked, during your treatment journey, were you very concerned about any of the following? And you can see here that overwhelmingly 74% of the patients we surveyed were the overall cost of treatment had a great impact. The long-term side effects, being a burden to others, and access to the best medical care. In addition to help with direct medical costs, 43% or almost half of our patients also reported help affording the day-to-day cost of living expenses, those out-of-pocket things like affording transportation, making sure your rent and your mortgage are paid on time, nutritional needs, those sorts of things. Again, we asked what impact did financial hardship have on you in the last 12 months? 57% had to dip into savings. 36% paid medical bills before other costs because they want to make sure they can continue their treatments. Several of them skipped or delayed a medical procedure, which we all know that's not the best practice, and 37% sought a lower cost alternative. When patients cannot afford care, they are often forced to alter their care either by skipping, postponing, or making alternate and less ideal treatment decisions. They may change how they pay for care and prioritize paying for care. They may pay their physician or their hospital bills prior to paying their mortgage. So they're often forced to choose between medication and groceries, how to pay for daycare if they have kids, that sort of thing. 28% of our patients reported stopping or skipping a medication as a result of cost. So with that, if you have any questions, put them into the chat. But moving forward, I'd like to turn this over to Christina, who is the Senior Director of the Assistance Fund, to talk about what they do.
Thank you, Alan. So I'm Christina Hartman, and I run advocacy at the Assistance Fund. So we are a charity. We've been around for a decade now, headquartered in Orlando, Florida, but just last year opened an office in Washington, D.C., which is where I am now. And hopefully soon you'll all be able to come visit us here downtown, right in the Metro Center area. So hopefully in 2021, we'll get back to doing these meetings in person. Fingers crossed. So I'm here today to talk to you about mitigating familial financial toxicity through planning. So this is an issue that I am very familiar with. As many of you know, my youngest daughter, Charlotte, has a rare neurogenetic disorder. So Charlotte was born in 2016, diagnosed in 2018, and is now 4 years old. She has the developmental age of a 1-year-old, and so every year that goes by, she gets bigger and things become more and more challenging. I think all those of you with children with developmental disabilities or rare disorders are dealing with the impact of the pandemic on top of this. So as you know, having the kids at home, trying to juggle work, doctor visits, televisits, whatever it may be, is becoming incredibly challenging. Our family has been working to try to get the developmental disability Medicaid waiver. We live in Maryland, so that's one thing we're looking to do, for Charlotte's future to secure that. We currently have been putting our resources into retaining a special needs education attorney to try to make sure that she's able to get what she needs, which is a bit impossible right now with all the virtual schooling. And eventually, once we get that sorted out, we're hoping to establish a special needs trust to try to prepare for Charlotte's future, since, she will probably outlive us, but will never be able to take care of herself. So again, this is an issue that I'm very familiar with, and I appreciated being in this group last year because I learned quite a bit from one of the other moms who talked about her journey. She is a child who is about to be 20, and she's been through all of this, has done it all. One of the other big areas that I think especially these rare genetic disorders are going to have to navigate is the Social Security disability space, because as you know, it's very difficult to add additional disease categories there and to ensure that these new diseases that are coming online will be eligible for assistance with Social Security, et cetera. So the system has not quite caught up to where it needs to be as we see all of these new diagnoses coming online. But I want you all to know that this is something that I'm living every day myself. And, my day job is to continue to advocate for all of you in Washington. And we are going to do our best to reform the system for all of our kids and adults who are living with rare diseases. So the Assistance Fund, again, I'm very excited to be here in Washington and to have opened this office right downtown where we can really exert influence on the administration, legislatively, et cetera. So a little bit about the Assistance Fund. We receive from our patients almost every day just thanks for being there and thanks for doing what we do. When I first started, my first day on board, I was sent down to Orlando and I listened in on some of the calls that are made by patients to our patient advocates. And what was so moving was just how grateful the patients were for the assistance that was being provided. It was abundantly clear that without this assistance, these patients were not going to be able to adhere to their medication and put food on the table or pay their electric bill. So there's a great need out there, and Alan talked quite a bit about that, but I think there's no question about the need. So at Taft, our hope is we'd like to see the day when no person goes without treatment because of an inability to pay. And as you can see, we recently expanded our mission to include advocacy, which is what our team is doing here in the Washington office. So a little bit about Taft's programs. We have 70 disease-specific programs, and I'll show you a list of those in just a moment. We have 3 types of assistance: copay, health insurance premium, and incidental medical expenses. I'll also go into depth on those a little bit more in a moment. We do accept patients into disease programs, and they receive a year of support before they need to re-enroll. There's no cap on the amount of assistance a patient receives in a calendar year, which requires us to be quite financially innovative, especially as some of these newer and more expensive treatments are coming online. We want to ensure that whatever FDA-approved treatment a patient comes to us with, that it will be covered if they're enrolled in one of our disease funds. 81% of the individuals we currently serve are Medicare beneficiaries. We do expect our Medicaid population to explode as these rare treatments continue to come online. I think all of you are aware that the majority of new drug approvals are rare. Almost 95% of rare diseases do not have an FDA-approved treatment, so we're going to be seeing a lot more of those coming online in the next several years. And so we will have to find a way to ensure patients have access. Another really important thing about Taft is that 96% of every dollar that comes in here goes straight to assisting patients through our disease programs. And I think that that's incredibly important because we are such a large charity. We like to show where these dollars are going. A couple things that have come up over the past year since I've been at Taft. I've heard from patients that there's a great need to receive travel assistance for participation in clinical trials. I've also heard from patients that they'd like to see coverage for genomic sequencing for the large population of undiagnosed patients in the rare community. Unfortunately, this is not something that Taft can currently assist with because of the limitations placed on us by our opinion from the HHS Office of the Inspector General, but we are looking at ways over time that we can ensure that that need is met, and we're committed to working with our partners in the space and with the disease groups like Global Genes to make sure that patients have the access that they need. So this is a list of our 70 disease-specific programs. This list is also available on our website at taftcares.org. And a little bit about our impact. So again, TAF is a decade old, and we've served nearly 125,000 individual patients in this decade of our existence. And just this year, we hit over $1 billion in total assistance provided to patients, which is a very exciting benchmark for us. As long as that need is there, we're going to continue to serve patients. In 2019, we served over 50,000 patients, and we currently reach all 50 states and U.S. territories. So I did get a question last year quite a bit, what are we doing globally? And unfortunately, at this point in time, just due to the unique nature of the United States and our laws and regulations, we are only able to serve patients in the U.S., though I very much understand the global need and look forward to working with you all over time to figure out how do we meet the need for the world. I also wanted to talk a little bit about our growth. So I did get a question last year. TAF is really growing over the past couple of years. We've essentially doubled in size. And so many people have come to us and said, well, how do I get my disease on the list? How do I get assistance for my disease state? And we would like to be able to meet the need of everyone that's out there, because again, I understand the need is so great. The way the process works at TAF, because again, we are very highly regulated as a large charity. So our disease programs come from input from our independent medical advisory board. They are doctors who make recommendations to our board of directors about disease states where there's a need to provide assistance. And again, there must be an FDA-approved treatment for us to be able to move this process forward. Once the medical advisory board makes a recommendation, the board of directors will vote on the disease. And then once we have secured a funder, and we do solicit donations from all pharmaceutical companies with approved therapies in a specific disease area, once a donation is secured, then you will see a disease program open on our website. We also work very hard to try to ensure that if we are not able to provide assistance, if a disease fund is closed, because there are limited resources in every fund, that we are able to refer patients to other programs, to other charities like PAF, like NORD, like PSI, like PAN. We have many partners in this space. And in terms of independence and compliance, I just wanted to highlight a bit about how seriously we take this issue. So like I said, there are a lot of needs that we've identified, but because we are so highly regulated, it is a process to work through to make sure that we can provide assistance as it's needed. And again, we've identified some of these additional needs. We believe we will be able to meet them between TAF and our partners in this space, but it is a process of ensuring that we can do so compliantly with the regulations that have been handed to us by the HHS Office of the Inspector General. And then just a little bit about specifically what we do for patients. So these are those 3 programs I mentioned: copay assistance, which is our largest single program, and of all 70 disease funds, they all include copay assistance. So this is the assistance we provide to help patients bridge the gap between what drugs cost and what they can afford. We also provide premium assistance for several of our disease states, and this is assistance with health insurance. You may know that there are laws that prohibit us from directly paying insurance premiums for individuals, but we are able to provide reimbursement for insurance premiums to ensure that sick people are able to stay on the rolls and are able to access their health insurance. And then the last program, incidental medical expenses, this is becoming a great need, especially with COVID, we're seeing. And again, I continue to hear from folks about the need to provide travel assistance for clinical trials. And again, while this is not something we can currently do, we understand the need is there, and we are looking into how this can be met. But in the interim, we will continue to provide the incidental medical expenses for those patients in our 70 disease-specific funds. And our online enrollment is very simple. So if you go to taftcares.org, you can see right on there, you can click through to the different disease programs that we have available. You can see which ones are open, which ones we have a wait list for, et cetera. And feel free to reach out to myself or anyone else at Taft if you have any additional questions about enrollment. We also like to try to figure out how we can partner with different disease-specific groups to make sure that these resources are highlighted for the patients and that they can access them easily. We want people to know that this is there for them. In terms of eligibility criteria, again, we run on a 12-month program approval with an annual renewal process. You do have to be a U.S. or permanent resident. You must have a qualifying disease, et cetera. And again, this is all also available on our website. And just a little bit more about how we establish and manage our disease programs, because again, I did get a lot of questions about this last year. So really the key is we have to be able to identify that need. The Medical Advisory Board will review it. They will do a huge assessment looking at the disease state and evaluating it. They'll do a formal review. The Board of Directors will do a formal review, and then we will be doing quarterly reports on that. It's a pretty big deal to administer disease programs of this magnitude, but Taft does it very, very well. They've really taken their time over the past 10 years to make sure that we have all the analytics and reporting in place. Our patient advocates, who are the folks who answer the phones at our call center in Orlando, which is our in-house call center, they are all trained and they are ready to work with patients to ensure that they understand their needs and we can address them. Now, we did establish a COVID-19 health insurance assistance program, and we did this very early on in the pandemic because we realized that unemployment was exploding, and we wanted to ensure that as many of our patients as possible were able to remain on their insurance. So this is a program specifically established to provide assistance with health insurance premiums through the duration of the pandemic. It is currently limited to existing Taft patients, but if anybody has a challenge, please feel free to reach out to us and we will try to direct you to other resources if we cannot help you directly. I also got a lot of questions about our disease program wait lists. So this is another area that is very highly regulated for us, but we do have wait lists in place and are happy to speak with you further about this if you have any specific questions about the wait lists. And finally, this is my favorite topic, our advocacy work. So again, as you know, we established this office in Washington, D.C. last year. Our goal is to really advocate on behalf of underinsured patients and help remove the barriers that they have to access. Our goal is to lower the cost to patients for treatments, for therapies, for anything that they need to make their life better and healthier. So from the office, our plan is to really continue to engage different patient advocacy organizations, understand their priorities, and help them carry their agendas forward with Congress and with the administration. A little bit about myself, I have worked in Washington for the past 20 years, and I started my career at the U.S. Department of Health and Human Services. I've seen it all. And funny enough, I did not know a thing about rare diseases until my daughter was born in 2016. So I think that is unfortunate unfortunately quite common in the Washington community. If you look at infectious diseases, we hear all about them. You look at non-communicable diseases, heart disease, stroke, diabetes, hypertension, those all have billions of dollars behind them. Everybody's paying attention. We've got our work cut out for us with rare diseases, but I'm confident that we're going to be able to tell this story and get the resources dedicated to this area that it really deserves. And then I also just wanted to quickly note that one of the big projects that we'll be launching, and this is related to another session that happened, I think, earlier today on value and access. But as we are seeing more and more FDA-approved treatments coming down the pike, specifically indicated for rare diseases, many of these new treatments are incredibly expensive therapies. We've all seen what's happened with Kymriah and Zolgensma and Luxturna. We know there's a hemophilia drug coming down the pipeline soon. There's many of them on their way. Even here at Taft, we're not sure yet how we're going to financially innovate to ensure that if we get, say, a hemophilia patient in our fund on a new gene therapy with a 6 or 7 figure price tag, that we won't bankrupt that entire fund. And it's not just us. I mean, the state Medicaid systems, as we all know, they've even had challenges with Zolgensma. We've heard from state Medicaid directors over the past year or so, their budgets are limited. The resources that they have can't possibly cover this drug for everyone who needs it. We've even seen with the private insurers, very public fights. United Healthcare, there was a big story in the Washington Post about a local family that fought for access to the new gene therapy. So this is something that we're going to continue to see. So Taft is committed to really getting the patient community together and making sure that the leaders in rare, including those at Global Genes, those at the Every Life Foundation, those at NORD, those at our other partner organizations, are leading the charge on this issue and ensuring that the cost to patients and patient access remain the primary consideration as these therapies come online and as we figure out ways for the Medicaid systems and others to pay for them. So we have commissioned some research from Levitt Partners that will be issued in early October, and that white paper will address the challenges and opportunities for Medicaid coverage for cell and gene therapies going forward. This is a very timely issue, again, as we know that these new therapies are going to be flooding the market at the same time as the state Medicaid systems roles are expanding to levels that I don't think we've ever seen before. And finally, just wanted to end with another quote from one of our patients. Again, we continue to hear from them, and we want them to know that we hear you. Your need resonates, and we are all here to help you get what you need. We're all behind you. And feel free to reach out to myself, to anyone on the Taft team. The Orlando office is listed on there, as well as the DC office, where we've recently expanded, and happy to report we have several advocates here in the DC office who will be working on your behalf and who I know look forward to meeting you, hopefully in person in 2021 at Global Genes next year.
Thank you, Christina. So far, we've heard from Patient Advocate Foundation perspective that really gets down in the weeds and helps patients on their day-to-day issues and helping access issues. We've heard from a copay program that helps patients to access their medications, but also from the perspective of a caregiver. So now we're going to hear from the perspective of a patient. And so it gives me great pleasure to introduce Barby Ingle, who is the president of the International Pain Foundation. Take it away, Barby.
Thank you so much. I'm so glad to be here. Thank you to Global Genes. And I am a chronic pain patient, and I have multiple rare diseases that I am living with. And I wanted to come and share with you some of the tips and tools that I've learned over the years. I've had over $1 million in medical expenses with living with rare diseases, and some of the things that I learned have been very beneficial and helpful. I use the resources such as copay relief and have accessed patient advocates in the past, and that's why I started to speak out, share my story, and talk about some of the things that you can do in addition to those resources. So one of the first things that I learned the very hard way was how to read an explanation of benefits. And 8 out of 10 medical bills, according to JCAHO, has a mistake on it, 8 out of 10. And realizing that even if your name is spelled incorrectly, it can affect how much your insurance company or even Medicare pays for that treatment option or condition that you're trying to receive treatment for or gain access to. So that was the first thing, was learning how to read the explanation of benefits and comparing that to the doctor bills that I was receiving to see what was my actual patient responsibility and how can I make sure that I can continue care, because living with multiple rare diseases, I had to be able to continue care, and I was afraid that they would cut off my care if I couldn't pay the bills. So the second tip that I learned after learning how to understand my EOBs and my medical bills and being able to compare them and let them know, the doctor's offices know that there's a mistake on that bill, please correct it so it can process correctly. The next thing that I learned was that with credit, if you put a medical bill onto your credit card, that's basically putting it under a contract that it does not have if you're paying the doctor's office or the hospital directly. And I just stopped putting them onto my credit cards and started making arrangements with the medical provider directly, where I could say, you know, I can pay $10 a month towards this bill. It might take me 10 years to pay off the bill, but there's no official contract with a medical doctor's office that you have to pay like you do with a credit card. So you don't have the increase in interest and those types of things. So that's been very beneficial. And then I also have had to go through step therapy a few times, having conditions that are not approved treatment options by the FDA. I've had to get very creative. And one of the things I found with step therapy and going through getting the medications that I need was to have to fill out a FDA 3500 form that was optional form, not necessarily something bad happened with this medication, but I've tried the medications that the insurance company or Medicare is now asking me to try, and I was able to go back to the doctor's office and say, I had these reactions, keep track of those. And when the insurance company came back and said, you need to try these other medications, I was able to say, I've already tried them. I have a FDA Med Form 3500A on file, and was able to then get the medication I needed covered, even though it wasn't approved by the FDA specifically for my condition. So that was one way around that. So with that, I'm going to wait and see what kind of questions we have coming in so that we have time to answer questions from some of you guys, and hopefully we can get to quite a few of your questions. So thank you for having me today.
Thank you, Barbie. I think that, you know, regardless of who we're working with, you know, organizational-wise or even trying to do on our own, the challenges are all the same. The healthcare system is fragmented. I think we all know that. And I think it's, you know, for you, Barbie, as a patient, having to take matters into your own hands and navigate the system while battling disease can be very difficult. So I want to pose to both you and Christina, particularly with Christina, with you having a child that you're caregiving for and advocating for on her behalf, you know, what do you see as the biggest challenges for yourself, your family, or the patients you work with related to patients and families, you know, navigating medical costs, particularly in the rare disease space?
Barbie, do you want to go first?
Jump in.
Okay, so for me, some of the things that I see are things that I've had to face myself, but other patients are reporting. For instance, you want to do a treatment option that's been showing promising results in other patients that have the same condition, yet they're not approved, so you have trouble getting them. One of the things that I did, I wasn't physically able to. I was in a wheelchair for 7 years and bedbound. my family actually held fundraising type events like a bowl-a-thon for Barbie and other types of events like that to raise some of the funds that we needed to get the treatment options available. But one of the things that I did, the treatment that got me out of a wheelchair to walking, that particular treatment was an IV infusion treatment. And they told me it was going to be $18,000. It ended up being $114,000. And I was like, what am I going to do? I didn't raise that much money. So I went back to my insurance company afterwards and said, can you please help me negotiate this bill? And they ordered my medical records from the hospital in the doctor's office and saw that it took me from wheelchair to walking. And in that, seeing those records and how much improvement that treatment gave me, they ended up paying for that treatment. Even though they started off saying you have a rare disease and we're not going to cover this, they ended up covering it because it was allowing me to be upright and be mobile and be more active in society. So although it took me some time to fundraise to be able to get the treatment option in the first place, or my family to fundraise to get me that option, it ended up costing way more than they projected. And my insurance company stepped in, paid it all, and I actually ended up getting a refund and only had to pay $100 out of pocket instead of $18,000. So it really did make a difference in the insurance company seeing afterwards that it was a benefit. And if you can raise enough money to get the treatment option and it has that much benefit for you, then that could be one of the options that helps you overcome those obstacles as well.
And how about you, Christina?
So I would say what was interesting to me coming into this space and, having Charlotte, and yet there are so many patients out there where their disease group has been around a while, they've done the work, they've finally got an FDA approved treatment, and then they can't access it. So I think that is the fear that we all have. I mean, we've heard from Barbie, right? The treatments you needed were out there, but they were exorbitantly expensive, right? And you had this fear that you wouldn't even be able to receive them. And it's appalling to me that in this day and age, that's still the situation, because we know it doesn't have to be this way. Patients should not wonder if they're going to be able to access a treatment that's been FDA approved. Don't even get me started on the clinical trial side, right? But when you have an FDA approved treatment, when your disease community is lucky enough to have that, the last thing we should be worrying about is access. So I would say that's my number one concern is, as we see more and more treatments coming down the pike, how do we ensure that patient energy, what should be focused, and caregiver energy, which should be focused on just the challenges of day-to-day living with these disorders, let's make sure they're not focused on trying to figure out how do I pay for this treatment, which should be available.
And that's where somebody like Patient Advocate Foundation come in to help, because we can help you navigate through that system. If you don't have the wherewithal and the dedication like Barbie had to do it on her own, we can help you do it. We can help work with your provider to get those letters of medical necessity for an non-approved FDA drug if there's not one out there. I know last year when a colleague and I exhibited at Global Genes for the first time, we had so many patients that came up and said, oh my gosh, I wish I'd heard about you 9 years ago, because you really could have helped me navigate my journey through the healthcare system. So that's what we're here to do. Another question that I wanted to ask is, because I know we're getting a little bit short on time, but how has COVID-19 affected your journey and the work you're doing? Because I know it's affected us at Patient Advocate Foundation. We've had, like Taft, we've had several COVID-19 emergency funds to help patients that are being impacted, either diagnosed with or being impacted by because they've been unemployed. And just the fact that patients weren't going for their elective screenings, we found that patients are getting diagnosed later in stages, because now they're just now starting to go for their screenings, their mammograms, their colonoscopies, that sort of thing. What has the impact been on you guys within the rare community?
Well, at the Assistance Fund, like PAF, we do help patients navigate as best we can. But our greater concern is, how are we going to fix this system, right? Because we've seen with COVID-19, as things start to break down, as you're not able to access, for many of these families, the assistance that you would receive, the caregiver assistance, the respite care that you would receive at your homes, people are on their own. And so even beyond the treatments, how do we ensure that these kids in particular are not falling behind, right? There's been a lot of regression that we've all been seeing. Children are not able to access their therapies, which we all know that early and intense intervention is so important, whether it's physical therapy, occupational therapy, speech therapy, the special education so many of them receive. All these things are falling through the cracks. And so I know that my family feels incredibly lucky that we've been able to piece things together. My husband and I are lucky that we still have our jobs, right? And we are able to continue them. We are able to access the caregiving that we need for Charlotte. But it comes at a cost, and it's a cost that even for us is not sustainable. So I think we're all concerned about COVID-19. What is the financial impact on families, on individual patients? Because again, it was bad before, and while all of us are here trying to help navigate it, it's systemic change that's needed. And I hope that this crisis is the impetus that our society needs to move things forward.
How about you, Barbie?
So in the rare patients that we work with through International Pain Foundation, as well as myself, when COVID, the lockdown started and the pandemic hit, we saw that patients weren't able to get the treatments that they needed in a normal, timely fashion. And for me and for people with reflex sympathetic dystrophy, if we don't get our infusions, it makes us bedbound. It puts us back into wheelchairs or needing tools to get through life, like canes and walkers and these types of things. So over the last few months, we've seen a lot of people, since they stopped all infusions for our condition for at least the first few months of that lockdown, now they're trying to get caught up and get the treatment options. But now there's a backlog of patients that need to get the treatment options, and the number of patients that they see each day has been limited. And even for me, I developed a couple of lumps during this pandemic timeframe, and I have had to stall my treatment to find out. I'm just now yesterday, I went in. I know that I have a genetic breast cancer, genetic related breast cancer that I've already been through, and went through a lumpectomy, and they're watching me for that. I have not had any screening during the pandemic, but yesterday I actually got a blood test for ovarian cancer now, because I've developed 2 masses. And this is something that I noticed back in March, but they just now were able to get me in, and they can't do the surgical procedure that they need to do until November. So it's definitely, because of the way that they're scheduling everything out with COVID, it's definitely added to the burden, the financial burden of getting the treatment options that we need by delaying the care, because they can't let as many people in at the same time that they were doing prior to COVID.
Right. A couple of questions that came in the chat real quick, and I think hopefully we've addressed, there was a question about, FDA approved drugs that you can't get access to, and I think we've talked a little bit about that. There was one that just came in about recommending patients get an attorney to get SSDI. And I'm going to speak from the Patient Advocate Foundation source. We try to advise against that, because once you've engaged an attorney, you can't really advocate for yourself, because it has to all go through the attorney. I remember I was talking to a patient that they had engaged an attorney, and they weren't feeling the attorney was doing the things that needed to be done to get their son on SSDI. And we weren't able to help them because they had already engaged an attorney. Have y'all had any experience with that as well? I see Barbie shaking her head, yes.
Yes, I actually don't advise using an attorney either. I advise that the patient works with their medical doctors, make sure that all the paperwork is filled out. And I know it takes a little extra stress on the patient to do that. But again, as you contact the attorney, it cuts off that communication between the patient and the provider, as well as the Social Security office staff. So for me, it definitely made a difference. And I applied for my own and was able to receive it and not using an attorney. So as long as you fill out the paperwork properly, it should be something that you can get through. But if you need to, you can call International Pain Foundation or the Patient Assistance Fund, or Patient Advocate Fund, or the Assistance Fund to get help and have somebody walk you through it without having that lawyer put a kibosh on your communication with everybody that you're trying to communicate with.
Plus the added expense.
Yeah, and I haven't gone through SSDI yet because our disorder is so new that it's not even on the list yet. So our issue is trying to get it on there, which I know many disease groups have gone through that. My experience in terms of retaining attorneys, we have a dual working parent household where we before the pandemic we're not home very often. We're your typical dual working parent household in DC. So for our family, attorneys in this situation are pretty important. Our special needs education attorney has really been pushing the county. And for us, part of it is seeking reimbursement for a lot of those expenses that would be covered, like the 3 times a week speech therapist that is, we're putting $1,000 a month on the credit card for, things like that, and seeking that reimbursement. So for us, I think it makes sense. And when we eventually do a special needs trust, because I can't do both at the same time, I eventually will retain an attorney for that as well. So I think it just depends on your individual situation and the hours in the day. But I know I wish that there were a central clearinghouse where you could look up, who are the best attorneys in the special needs space, particular to your state. So maybe that's something we can all create.
Absolutely. Yeah.
So
can I add one more thing?
Yeah, sure.
When you do have an attorney for Social Security disability, one of the things that I've heard from other patients that used attorneys was that attorney receives a portion of their back pay, but they also receive a portion of their check for the rest of their life. So every month when you get a check, they do take many lawyers do take a percentage, and that's money that as a rare patient I would want to have. I wouldn't want to be paying that lawyer for the rest of my life that I'm on disability every single month. So if you can either negotiate that up front with the lawyer or figure out a way to fill out the paperwork between you and your providers, that could be very beneficial.
So best piece of advice there is do your homework. So we have just a couple of minutes left. So if there's one piece of advice that you could give to patients within the rare community in a few words or less, what would it be? And I'll start with Christina.
I would say just, keep your head up, get up every day, take it all in stride. I think it can be completely overwhelming. And so I just have to every day say, this is what I can do today. I'm going to focus on that. I can't change the world for tomorrow. I'll keep at it over time, but, just one day at a time. And the best advice I ever received when I got Charlotte's diagnosis from a fellow rare parent was, you can't focus solely on your rare child. You have another child. They could get hit by a bus tomorrow. You just have to think holistically. You can't make this your entire life. So for me, that's been a pretty important North Star, is just look at the big picture day to day.
And Barbie?
So my advice would be get as organized as you can. For me, I'm on my 10th 3-inch binder of medical records as well as medical bills. And I keep track of all my bills. I compare them to my EOBs, and be as organized as you can so that when challenges do pop up, like step therapy or prior authorization practices, you have the ability to go back, look through your records, as well as keep track of your medical bills and statements so that you can be accurate and say, look, I've gone through this experience before, and have that track record so that you can not get overwhelmed with the financial aspects of living with a rare disease or caring for someone with a rare disease.
And my piece of advice would be to know that you're not in it alone. There are resources out there. You've just met 3 today that can help you through your journey. Find out the other resources that are out there. I really want to thank Barbie and Christina for a great conversation. I hope we've given you a lot of information out in the audience. And thank you for your questions as well. Please join us next for Patient Stories, How to Become a Proactive Financial Advocate for Young Adults. It's been a pleasure spending the afternoon with you guys. Stay safe, wear your mask, and social distance. And again, Barby and Christina, thank you so much.
Thank you.
Thank you. Have a great day.